Coming to Pontics. Pontics are artificial tooth on a fixed dental prosthesis that replaces a missing natural tooth, restores its function, and usually fills the space which is previously occupied by the clinical crown. They are classified in the form of, according to the mucosal contact, as ridge lap, modified ridge lap, ovate, and conical. Those with no mucosal contact can be classified as sanitary and modified sanitary pontics. Now, ridge lap pontics are the pontics which have contact with the ridge on both buccal as well as the lingual aspects, whereas modified ridge laps have a point pressureless contact with the ridge, and they are the ones which are preferred in the aesthetic zone of the maxillary and the mandibular arches. And ovate pontics are the ones which are given in the aesthetic area, but then there is surgical preparation of the ridge which is required to receive them. And conical, as the name suggests, are conical in form, and they are normally preferred in mandibular posterior regions wherever the ridge is thin. Now, coming to the pontics with no mucosal contact, we have the sanitary or the hygienic pontic, in which there is space between the surface of the pontic and the ridge, and it asks for a minimum of a 3 millimeter space. And in situations where we have less space, we could prefer to have a modified sanitary or a hygienic pontic, which is more of a archway. That means it is a concave in shape on the underside. Now, depending on the materials, we could have pontics which are all metal, we could have non-metal, or we could have a combination of porcelain and metal. Depending on manufacturer design, we have pontics which are flat backs, through pontics, pontips, long pin facings, and reverse pin facings. So these facings can be adjusted by the dentist and then glazed if necessary, and they have a metal backing to provide them strength. So these are the prefabricated designs which are available.